My guest on the program is Dr. Faisal Shuaib, the Executive Secretary of the National Primary Healthcare Development Agency. He walks us through the plans to increase the number of vaccinated Nigerians, and we want to know if there's a timeline being followed in these efforts, how much work is being done by subnationals in this regard, and is talking enough to get people to be less hesitant to the COVID-19 vaccine. Dr. Shuaib, welcome to Data in Abuja.
Thank you very much for having me.
You've come a long way handling Ebola, then polio, and now COVID. How has this journey been since 2017?
The advantage of having COVID-19 and really dealing with it is that early on we have a vaccine that is safe, a vaccine that is efficient, effective in trying to overcome the disease. So that potentially makes it probably easier to manage than the previous sorts of infectious disease conditions that we faced.
So let's talk about vaccinations. Vaccine hesitancy is a real thing, especially in rural areas. Even here in the FCT, what plans do you have to handle these conspiracy theories that many of these Nigerians are believing, and because of that refusing to get this vaccine that you've done so much to get for them?
The vaccine hesitancy around COVID-19 is a global phenomenon. It's not localized to Nigeria. And really, the solution to it is exactly similar. We have to provide people with the correct information about the vaccines and vaccination in general. We understand that if people don't have the right information, that they will not be able to take the right decisions. So whether it's a traditional ruler, a religious leader, that may not necessarily be their forte, right? Unless, of course, they have public health training, then you understand that they have all of the information to make the right decisions. For example, you're not going to call a carpenter to come and fix your broken down car, right? So it is our responsibility in the public health space to make sure that we provide the correct information to all of these leaders so that they can make an informed decision and also communicate the same to those people who look up to them. So the buck stops on our table, that we have to work extra hard, not only at the National Primary Healthcare Development Agency, but across the different ministries, the agencies such as the National Orientation Agency, that is responsible for social mobilization. We just need to provide Nigerians with adequate information and make sure that we also debunk all of this false information around COVID-19 vaccination.
You're dealing with a country where people see themselves as people versus government. So every information that's coming from government is questionable to the people. And that's because of years of distrust. How are you going to deal with that?
I think really it depends on who you speak with. There are people out there that believe in the work that government is doing. There are people, of course, that are also skeptical about government. This is what happens all over the world. It is part of the very nature of humans to be cynical sometimes, right? But what we're doing at the agency, along with our partners and other agencies and ministries, is to try and put the facts in front of Nigerians, and also using people in the private sector, independent voices who do not have the so-called tainting of government, right? They speak about the vaccines, they talk about what their experiences are, and they lay the facts out there. These people are on record, they are on videos that we're sharing all across the country to tell Nigerians that this is not about government, this is not about a particular political party, this is about the health of Nigerians, and we care about the health of Nigerians. This is why we're in this business, right? So the same way we work together with Nigerians to eradicate Ebola, right? To eradicate white polio viruses, is the same way that we're working with Nigerians and will continue to push, right? This is why we're here, right? When we went to the Ebola battlefront, right, it was at great risks to our health. In the white polio virus struggles all across the country, especially in the last frontiers of the white polio virus battles, right, it took a lot of courage for our teams to get to places that were insecure, to get the vaccines out there. And what have we achieved from all of those efforts? We eradicate Ebola at great risk to our health. We eradicate white polio viruses at great risk to our health, to our lives. We do this because we feel it is our calling. It is a sacred trust between the work we do as public health practitioners and our role to ensure that we protect Nigerians. If we're doing this, laying our lives on the line for Nigerians, why would COVID-19 be different, right? This is what we do. This is our calling, right? It is like we are the civilian military.
It's easy to tell people in urban centers, you can't enter the NPHCDA without a face mask. You have to sanitize before you go into the Federal Secretariat. These are things that are easy to do in urban centers, but in rural areas, where the infrastructure necessary for people to be able to adhere to these non-pharmaceutical guidelines do not exist in many of these places. How are you going to ensure that they're able to keep to these guidelines and buy into a nationwide vaccination exercise when the risk for them seems like a waste of time?
So we're working with the Nigeria Center for Disease Control and all of our partners towards ensuring that at the community level, we have primary healthcare workers and community-based health workers that are engaging with these communities. Part of the reason why you see people not wanting to wear masks and not observing social distancing, like has been provided for by the Presidential Steering Committee on COVID-19, is that low perception of risk. People do not feel like, it's, worth their while to wear face masks because they don't feel that they're going to fall sick. But the very nature of COVID-19 is such that you never know how your body is going to react to it, right? You may contract the virus and you have a very mild disease and you are lucky. But you may also contract the virus and that could be, a one-way road to death, to hospitalization and death. Why would you want to take a chance when you don't know what the outcome will be? What the vaccine does is to protect you against severe disease, hospitalization, and death, right? The vaccine does come with some side effects. That is something that is known, and this is what we tell our health workers to communicate very, very clearly, right? So as long as we continue to have outbreaks of this disease, upsurges of this disease in our communities, we will continue to use the same templates that we used with the polio eradication program, which is using the gatekeepers, our community leaders, our religious leaders, to continue to speak to people in the community so that they understand why these vaccines are necessary. It is not going to be an easy task, but we're not here just because it's easy. We're here because it is what we signed up to do, it is what we believe in, and it's something that we're going to deliver for all Nigerians. Vaccination works. Vaccination protects against severe forms of COVID-19. It is something that all Nigerians should take so that we can now build herd immunity, which is immunity of at least 70% of eligible people in Nigeria. Once we have this herd immunity, then we have a greater chance of now getting rid of the face mask, and then we can begin to talk about returning to the pre-COVID types of lifestyles and all of our social engagements that we all miss so much.
Thank you so much, Dr. Faisal, for being with us on Dateline Abuja.
Thank you very much for having me.